Yes, indeed, we're live. Welcome back to Prime Morning on Joy Prime. I beg your pardon, Joy Prime. I'm a bit squeezy over there. Great conversation that was had on Beyond the Headlines. Quite interesting. And it's time for good living. Good living is very, very important. And most of all, the eye. The eye is a very vital part of our body. Take me, for example. I don't like people coming close or touching my eye at all because it's very important. It will surprise you. I wear glasses, yes. I need it to read. Sometimes when the place goes dark, I can't see nothing at all. So you can see how vital the eye is. Sometimes you don't even like playing with the eye at all. Even when you're rubbing, you see your parents screaming, "Ooh, you're scratching it," and stuff like that. Well, today I have a doctor with me here, somebody I haven't seen in years, but it's quite good to see her. Her name is Dr. Daisy Esiama Asari. She's an ophthalmologist with the University of Ghana Medical School and also with JH Medical Center. Good morning, Daisy. How are you doing?
Yeah, I'm fine. How are you too?
I'm doing fantastic. Quite,
refreshing,
excited because I get to see you again.
Yeah.
We're going to do one of my favorite conversations, the eye. We want to talk about it.
Yes.
Now, the eye. I know it's vital, but what role does it play? How important is the eye?
Okay, so of course we use our eyes to see. Without that, we'll not be able to recognize each other and all of that. But then, in simple terms, the eye works just like a camera. So just like you have your cameras here, there's the aperture that takes light inside, and then you have your images being formed on your film. The human eye works in a similar way. So we have light entering our eye, being reflected into the eye, then it passes through several structures in the eye, and then it forms an image at the back of the eye, which we call the film, which we call the retina. And depending on the state of your eye, well, the images formed may either be good quality, like that of maybe an iPhone 12 Pro Max, was that 13 now, or maybe a Nokia 3310. Yeah, so it depends on the state of the eye and then the quality of the images that you form. That's why we are so much concerned about eye health, because if the person is not seeing well, of course, a lot of daily activities will not be able to be done well, and then their job will also be affected.
I see. Let me ask you this quick thing. So what if too much light falls on the eye? Does it blind you?
Yes, it can give you glare.
Oh, I see.
Yes.
So
of course, nobody likes too much light in the eye.
Yes,
so.
okay, don't look up too much. Yeah. But when you say light falls on the eye, which kind of lighting is good enough for it? That at what level is it just quite okay that you can see everything perfectly?
Yes, so too much light obviously is not good. Too dim light is not good because you have to strain the eye. But moderate light, I mean, every individual will have an amount of light that will be going into a little bit of physics. But there's an amount of light that is tolerable for each eye. Yes, too much is not good, and then too little is also not good.
So but
without light in dark, you cannot see. So we also work with the dynamics of light.
Very, very important. I like that.
Yeah.
Now that let's go back a bit. You've told us what the importance of the eye and what it does. Can you tell us more? Take us through exactly more. I know we've seen some things on the screens. We've seen a lot of names and stuff like that on the screens. But can you just take us through more?
Okay. So when you look at a person, you see the eyes. We have two eyes, of course, unless something happens and then you lose one eye.
Yeah.
But then you have your brows, you have your lashes. Those are the other things that's from the eye. Then you have your eyelids that helps you to blink and put tears on the eye. So that it's not too dark. And then, well, we females are adding more eyelashes now, so we have longer ones now.
Yeah, just like on the screen.
Okay. So that's that. But when you come to the eye itself, so this is the eyeball.
Yeah.
Yes. So this is the eyeball. Looks like this. Behind here is a nerve called the optic nerve that connects the eye to the brain. So that's connects all the impulses. So that is what helps us to form the images and be able to recognize that, oh, I'm looking at this or I'm looking at that. All right. Now these other things here are what we call the muscles, the extraocular muscles. Okay. Now they connect the eyeball to the skull or the orbits. Okay. So that I can turn my eye without having to turn my head.
Is it ever possible that you can have a condition where you can't turn your eyes?
Yes, you can have restrictive conditions where it's difficult to have extraocular motilities. Yes.
Wow. So that must be very grave.
Yes.
Oh, wow.
It's actually called Graves' disease.
Are you serious?
Yeah, you're right.
I got that one there.
Yeah, so that's also one disease that causes restricted extraocular motilities. Yes, so that's the extraocular muscles. And then when you come here, this transparent thing is called the, maybe I can just open it up.
Wow.
Yes, so this transparent thing here is called the cornea. You may not be able to see it because it's very transparent, and we need it to be like that for the light to be able to enter the eye so you can have a good vision. And this is what we call the iris. So it's like the aperture of the eye. So it determines how much light will enter the eye. Can be smaller, can be bigger, and all of that. But this is what is colored. So most black people will say have brown eyes, black. Yes, or black, yes. And then we can have blue eyes and then green. Exactly, yes. So that is the iris. That's the colored part.
See.
Now behind it here is the lens. So this is the lens, like the lens of a camera. So it can become smaller so that you can focus images, or a bit wider so that you can focus images, depending on where it is, whether it's closer to you or it's further back. Yes, now in here it's not an empty cavity. There's a gel in the eye that we call the vitreous. That also helps with the interplay of refraction and then nutrition for the eye and all the other things.
There's nutrition for the eye.
Yes, exactly.
I see.
And then in here is our film, or what we call the retina. So it's a wide film, and you have a lot of vessels that supplies. Yes, so all these things help us to have good vision or to be able to focus images on the retina so we can see clearly. Now, so any disorder on any of the structures can lead to visual impairment or to blindness, depending on the severity.
Oh, wow. So what, with all this that you've told us, and with the eye nutrition and all, I'm sure it has to do a bit with our diet as well, right?
Yes, exactly.
Yes, so like we've been told, eat stuff that had vitamin A in them to give us good eyesight and stuff. People are eating well these days because of the situations in which we are in. People have found out about health, people are trying to stay healthy and stuff. But still, we are finding people getting blind.
Yeah.
What is causing all this blindness?
Okay, so there was a survey by the National Blind Survey, and then we found out that the commonest cause of blindness now is cataract. Cataract, yes. I'm sure a lot of people have heard about cataract. We call it a te.
Yeah, she had it.
Yes,
she had it. So I know at some point in time, at around 4 p.m., she wanted us to put the light on because she couldn't see or read the you know, the clock properly, or the room was getting dim for her.
Exactly.
Yeah, so I had to deal with it a little when she was around.
Yeah, so that's cataract. So the good thing about cataract is that it's operable.
Oh, it is?
It is. So then if you come early, and then we wake you up early, and then you don't have any other ocular pathology, you can get your vision back when we operate early, and then there are no other complications.
I see.
Yes, and then unfortunately that is what is really causing blindness in Ghana now. So this is the lens. So this is what was at the back of the eye.
Yes.
So this is what becomes it's supposed to be clear.
Yes.
Yes, so that you can have the images at the back of the eye. But if it becomes opaque or it becomes cloudy, that is what we call cataracts.
Oh, I see.
So it's a gradual, painless loss of vision. So you will not have any pain or anything that may prompt you to come to the hospital, but you just notice that your vision is just getting dimmer and dimmer. Okay, now there are several types of cataract. The first one is age-related. So I usually explain to my patients that it's like gray hair. As you grow, you tend to get it. Yes. So it becomes gradually opaque. Yes, so age-related. So maybe in your 50s, your 60s, you realize that, oh, my vision is not too good. So that is age-related. And then it can also be metabolic, like people who have diabetes. Some of them tend to develop cataract a little bit earlier than the average population or the normal population. Okay, and then we have the toxic ones, especially topical steroids. Ophthalmologists we don't like prescribing steroids unless it is very necessary that we give you steroids. And even in that, we tend to taper it off quite early. But unfortunately, we've realized that it's being sold over the counter. Yeah. So somebody has a red eye, and then they go to the pharmacy, and then they give them something with steroids. It's not a good practice because it can give you cataract, and it can give you a lot more complications like glaucoma and high eye pressures as well. Okay, so that is toxic. Now, other people are also born with cataract, unfortunately, like children.
I was just going to ask you, is it hereditary?
And it's not hereditary. It can be, well, some things can happen while the child is being born, but it's not like the mother passes it on to the child. Yes. Okay. So it can be congenital. That's what we say. So the child is born, and then gradually you realize that they have cataract. It can be bilateral, or it can be unilateral as well. So when you realize that there's your child, I mean, you'd see that there's a the problem.
So when it's happening, you can see it?
Yes, so when it becomes dense, you can see
that it's foggy.
That is, yes, and you can actually see that there's a white, when you look inside the person's eye, especially when it's in the dark and it's a bit dilated, you can see that, so something like this, okay? You can see that the person has a cataract inside. Yeah. So if you see like this, you should come to the hospital to see an ophthalmologist, and then we assess you, and then we will grade which place you are in the cataract. If it's operable, then we do the surgeries, and then you could have your vision back. Yeah.
So this thing happens over the time, so you need to be critical about watching your eye. So how do you how do you look at yourself to be able to tell that, oh, I'm having a problem here, or I'm having a problem here, or I'm beginning, or there's nobody to see that for you. So how do you determine yourself?
Okay, so when you're driving, sometimes if it's cataract, you have a lot of glare. Okay, it will be difficult when you come in the sun. It's like all of a sudden your vision is blurred. We call glare. That is when you have in the beginning part, and then because it's painless, what you would really realize about it is that your vision will start to go down. Okay. And it's subjective. So the person would be able to say that if it's a child and it's old enough, you'll be able to say, oh, maybe I'm not seeing well. If it's an adult, you realize that, oh, I'm not really seeing well.
Too well.
Yes. Or if it's our mothers and our grandmothers, they'll say, no, my eye is dim. Okay. Yeah. So those are the things that will help you to notice that you probably have to get an exam, and then we'll determine what the problem is.
I see. Yeah. But you mentioned something earlier that sometimes people tend to go to pharmacies to get steroids, they complain of a red eye. Can you explain a little, because that part I didn't see. Is it because probably I have a red eye, I get some medicine to help clear it? Those things have steroids in them?
Yes, so some of them do, actually. Some of them do. So commonly the normal Ghanaian will, or I'm having red eye, or I'm having eye ache. Then they walk into the pharmacy, and then they can give them antibiotics and a steroid combination. Okay. So you're safer with a plain antibiotic if you're not coming to the hospital. But I would say that if you're having eye pain, it could be anything. Yes. It could be something that we can manage without steroids. Okay. Yes. So if you'd have to go to the pharmacy at least, because the pharmacist will not be able to taper you off the steroids anyway, and you cannot have to. We've seen patients who've been on steroids for like a year. So when they're having eye pain, and then they go and take this, they go to the pharmacy, they give them a steroid antibiotic combination. It goes, it comes back, it goes, it comes back. So by the time they're coming to the hospital, it's been like over a year. Okay. Yes, and they've gotten a lot of complications. The pressures are high. They're probably developing cataract and all of that. Yes. So that is what we must be careful about the topical steroids. You mentioned
that having cataract is treatable.
Yeah.
So can you take us through some of the treatments?
Yeah, sure. So cataract is operable.
Yes, please.
We've come a long way, yes, with surgery. So we started with the ECC. That was, we were making a wider incision on the cornea. That's the transparent part of the eye.
Yeah, yes. It's on the screen.
Yes. So we're making incisions in there, and then the disadvantage with that is that it was after surgery. It was giving us a lot more astigmatism. The patient needed maybe some form of thicker glasses actually. And then we evolved by God's grace, and then we are now at small incision cataract surgery. So there the incisions are smaller. So what we do is that we make an incision in the eye, usually at the top where the lids cover, and then we do our things in the eye. Then we take out the cataract. We take this out because it's opaque. So we take it out, and then we wash out all the fragments that may be left, and then we put in an artificial lens. So what we are doing actually is that we are giving you glasses in your eye, but a smaller one. Oh. Okay, so we give you artificial glasses in the eye, and it's inert, which it means that your body will not react to it. Mm-hmm. Yes, you will not have any it can stay in the eye and be quiet and give you good vision. So that was small incision cataract surgery. And now the new thing we are doing is the phacoemulsification, which a lot of people call laser surgery.
Oh, she's going to ask you that.
A lot of people call laser surgery. Yeah. So that one is like the new kid on the block, okay. Sort of. Yeah. Okay. So we make smaller incisions, and then instead of taking the lens out in a hole, you know, when you take the lens out in a hole, the incision should be bigger. Mm-hmm. This one, we crack the lens inside the eye with the phacoemulsifier, then we bring it out, and then we give you an artificial lens. So better surgery. You
know, some of us, when it comes to surgeries and stuff, we are fearers, right?
Yeah, I know.
So we think the first thing you think about is, oh my God, it's going to hurt.
Exactly.
It's going to be painful.
Yeah.
Is there any such thing like that? Would there going to be pain? Would I have to close my eyes for like a week? Would it be plastered for like a year or something like that?
So for ophthalmologists, you know, we are not complicated like that. We are very friendly people. So what we do is that it's a day surgery, it's a day case. So depending, averagely maybe 30 minutes to 1 hour, you'll be done with the surgery. We don't put you to sleep. We give you a block. We call something a block.
You don't put us to sleep?
No, we don't put you to sleep. We don't put you to sleep with all the complications of general anesthesia. We don't put you to sleep. Okay. So we just give you a small injection down here. So it sort of gives you a local anesthesia. Mm-hmm. So you're able to, we work in the eye and you feel no pain. Mm-hmm. So the only pain you feel is when the small needle prick is coming for the first anesthesia. Yeah, so we inject the into the back of the eye, and then we anesthetize the whole place. Yeah. So you're not in pain, and then you lie down. We clean your eye, and then we start the surgery. On a normal day, maybe some very good surgeons, 15 minutes, 20 minutes, you're done.
15, 20 minutes?
Yes, you're done.
Oh my God, what was I thinking? This is going to take like 6 hours to get done. 15,
and then,
20, okay.
Yeah, so, and then you're done. So we clean you up, and then we plaster the eye just for 24 hours. Okay, and then you go home.
Get some rest.
You go get some rest. You come the next day, we take off the plaster, and then voila, everything is new.
That sounds very interesting.
Yeah.
Now, you know, we talked about eye health.
Yeah.
Now, how can we keep our eye healthy on a daily basis? What are some of the practices that we need to keep our eyes very healthy? Because we don't all want to go through and suffer all these things. Yeah. So how do we keep our eyes healthy? Generally healthy? How do we keep it healthy?
So generally, like all other diseases, you should have good health, nutrition-wise, exercise and all that. So a healthy eye lives in a healthy body.
Yes.
You see. So your general health should be okay to have healthy eyes. Now when you develop, the next thing is when you develop something like diabetes or hypertension, you should be able to get to the hospital to see an ophthalmologist for us to examine the eye, because diabetes can give you diabetic retinopathy and it can lead to blindness. But when we see it early, we can be able to do something about it. So I know the average Ghanaian would not just walk into a hospital for an eye exam, but I think it's about time we started doing that. And even after 40, we get what we call presbyopia. Yeah. You know that, I mean, it's difficult to read close. You have to send the thing like, so anytime you realize, I'm doing this, then you know that it's probably setting in, usually setting after 40. So you have an eye exam, that can be managed with glasses. If you have a child and they say, oh, mommy, I can't see clearly. Sometimes they're, oh, stop what you're doing, or they're pretending or something like that. Sometimes they really need glasses or something like that. And it can impact on their academic performance. Because, of course, if a child is sitting in class and I'm not seeing clearly on the board, I will not write well, I will lose concentration, and then at the end of the term, I won't do so well. Okay. And then again to screen time. Okay. There's something called the 20-20-20 rule. Like 20 minutes of screen time. 20 minutes. Look 20 feet away. That is as far as you can for at least 20 seconds. Okay. Yes. So for that one, it just, and it's especially for children, we realize that a lot of indoor play is making them a lot more short-sighted.
Oh.
Okay. You know, the olden days, all the children were playing outside.
Yeah, we were all playing outside.
Yeah, they can look as far, but now stay in the house. Every child has a PC or something, or Netflix or something they're watching. Yes. Yeah. So a lot of outdoor play would help. I know
some children on vacation right now will be very happy about this outdoor play. But I've been speaking with Dr. Daisy Esia Masari. Yes, she's an ophthalmologist with the University of Ghana Medical Center and also with GH Health Connect. Now, we're talking about eye health. We talked about cataracts. I'm opening the phone lines. The numbers are on your screen, 0302-2116. 0302-211694. Please call us. Any questions you have, Dr. Daisy is here to answer them for you. 0302-211693, 0302-211694. Please call us. Ask us questions. You need some help, maybe she can direct you in the right place. Let's get this because I know plenty people want to ask questions. Yeah. Somebody will ask, all these makeup and lashes and things that they do on the eyes, does it really affect it? Does it cause cataract as well?
No, it doesn't cause cataract, but sometimes it causes ocular irritations, especially when the mascara falls on the eye. Yes, it can give you some irritation, and you need to be seen. And then if we saw a patient, if the lash is not fixed well, it rubs on the cornea, the black part of the eye, the transparent part of the eye, actually, what you see as black. Yeah. Okay, so this transparent part, and it needs to be clear. So imagine you have scratches on this, like having scratches on your phone. Ooh. You see? Yeah, so that's about it. But it doesn't directly cause cataract or anything like that. It's just that because it's on the surface, it may cause some ocular irritations. Yes.
Ocular irritations.
Yes, eye irritations.
I'm really... And we have somebody on the line, Grace from Kumasi. Good morning. Thank you so much for joining us.
Good morning.
Good morning, Grace. Please go ahead with your question.
Okay. Please, recently I've been having this itchy. Like my eye is always itching, and I could feel something on it when I cleanse it, and it always turns red. I don't know the reason. So please, when I just watch it, then I saw it.
Okay, Dr. Daisy.
Okay, so she's having recurrent itching. Yes. And then redness. Is it redness?
Yeah, she said she tries to clean out and it gets
and it's
red.
both eyes or it's just one eye?
She didn't mention though.
Okay, all right. So so the lashes can get infected. Okay, so that's what we call blepharitis. So that's when you need to come to the hospital. You'll be seen, and then we'll teach you some ocular hygiene that you can do to relieve your symptoms. Then if your eye is really dry too, it can give you some irritation with a recurrent itching.
I see.
And then when you come and then we determine how dry it is, then we can give you ocular lubricant, and we can teach you how to maintain the eye itself.
I have Amina from Bolga on the line. Good morning, Amina. Thank you so much for joining us. I'm sorry, we lost Amina on the phone. But what else again? And I have Mr. Bewa on the line. Good morning. How are you?
I'm fine.
Thank you so much for joining us, sir. Hello, Mr. Bewa.
Thank you too.
Okay, please go ahead.
Please, one of my eye, the right side. I'm feeling pain on that right side. I don't know what is going on. So I want to ask you this.
Just the right side of your eye?
Yes.
Okay. Okay.
So he's having pain in the right eye.
Yeah.
Pain can be anything. It could be that his pressures are high, so he definitely needs an eye exam. And another thing too is that we have glaucoma. I'm sure you've heard about glaucoma.
Yes.
And then that is when, well, for some section of them, they have really high ocular pressures. Yes. So, and it comes like that, subtle eye pain, occasional eye pain, and it is also very blinding. Unlike cataract, when I operate the next day or a week or two, you could have your vision back. Glaucoma, it's a long journey, and unfortunately for some people, they can rapidly deteriorate. Wow. But when we find it out early, we'll know what best fits you, whether it's surgical or it's topical, then we'll know what to do for you. Okay. So ocular pain, if it's recurrent, you can have a dry eye that can give you occasional pain. But if it's unilateral, that's just one eye, and then you are having recurrent and constant pain, the earlier you be seen, the better. Because the eye machines...
Let me stop you there. Mr. David on the line, good morning. Oh, I lost him. Yeah. I'm so sorry for keeping you on the line for long. Please keep calling us on 0302-211-693, 0302-211-694. please call us. I'm so sorry we lost Mr. David over there, but you were saying something.
Yeah, so I was saying that if it's unilateral, then he really has to be seen. Because obviously there's something going on that's causing him to have pain in just one eye. Yes, and then if it's treatable, the earlier you're seeing, the better. We can treat you earlier.
Now, sometimes when you go to the hospital, they say you have pressure on your eye. What does that even mean in the first place?
Yes, it means that, like how you can have systemic hypertension.
Yes.
You're having the pressure in the eye, so it's high. And then why we don't want high pressures in the eye is that, you see this nerve at the back here?
Yeah.
Yes. If the pressure is high, it compresses the nerve. So there's gradual destruction of the nerve. And this nerve, when it's gone, it's gone.
Wow.
The body doesn't have
Please
it again.
hold on with the nerve being gone. I have Mr. Osei on the line. Good morning, Mr. Osei. Thank you so much for holding on. Thank you for joining us.
Good morning.
Please, sir, go ahead.
One of my eyes.
Yes, sir.
I see some lines on it. Like, it's so strange.
Yeah.
So I would ask that if it can be a cause of something.
Okay. Okay, sir. Thank you so much for joining us. And I have a call from Gore. So, good morning. Hello.
Hello.
Good morning, sir. Thank you so much for joining us.
You are welcome.
Sir, please lower the volume on your TV set so you can speak to us directly.
Good morning, madam.
Good morning, sir. Please go ahead with your question. Thank you so much for joining us.
My question is, anytime I finish reading,
yes, sir,
it's very difficult to see.
Oh.
Yeah.
Okay, sir.
I can't even look at I look at people's face, but I don't see clearly their faces.
Yes, sir. In both eyes?
Yes, both eyes.
Yes, sir. Thank you so much for your question. And I have a banda from Kumasi on the line. Good morning.
Yeah, good morning.
How are you doing, sir?
Yeah, please, sometimes I had a shake up in my eyes, like it shakes. So I don't know the reason. I want to know the reason.
Which eye, sir? Both eyes or maybe the left or the right?
Yeah, sometimes all of them.
Yes, sir. Okay, sure. Thank you so much for your question. Thank you so much for calling us.
Yeah.
So you can see, someone says there's a scratch on the eye, another says, you know, the pain. One says when they read, they can't even, you know, see after that.
Okay. So the one who said he had lines in the eye,
yes,
so that's, if I'm correct, that may be what we call floaters. Floaters. So the gel in the eye, so the space, the liquid in the eye can sometimes get dense, and it can give you all of those floaters. But then if it comes with flashes of light, like you see, the light is not flashing anywhere, but you can feel tiny flashes of light in your eye, like little lightnings, then that one is a cause for concern.
Yes.
It means that the retina, something is tagging on the retina. So, and if you have a detachment, it's a long surgery, yes. And then we cannot tell you how the vision may come, but the earlier you see us, then the better.
Daisy, please hold on. I have Daisy on the line. Hey, sorry. I have Abigail on the line. Good morning, Abigail. Hello, good morning, Abigail.
Hello.
How are you doing?
We are looking at the film.
Hello? Hello? Okay. I lost that one there. Let's go on.
Yeah, so means something is tagging on the retina, so he has to be seen actually before he ends up getting a detachment.
Okay.
But if it's floaters and then we examine and the ocular structures are fine, then there's really no cause for concern. As we all age, the vitreous gets denser and we'll have these things, yes. So if there's nothing sinister going on, then you're okay. The gentleman with the twitching of the eye, it could be dry eye or stress. Yes, those are some of the commonest causes where you can have the eyelids. I'm sure he meant the lids.
I've had that here. Sometimes you realize that it's just
shaking.
You don't even know what
it could be like dry eye, or it could be tired. Sometimes when people are tired, or tired for a long time, the eye tends to do that. Or fatigue, I should say.
Causes that.
Yeah.
And then there was a lady. Well, I think we've covered most of it. We've answered all those ones. Yes. So we're talking about the pressure on the eye and how it can be. Can you really go into it for us?
So if the pressures are high, it damages this nerve. It's called the optic nerve.
Yes.
So if the more it's being damaged, the more you're losing vision.
And what causes the pressure on the eye? Is it because of stress, work levels?
Oh, well, there are so many things. Glaucoma, we are still finding out the cause, but then we tend to get it, blacks, we can tend to get it a lot more. Yes, and it tends to run in families too. So if you have any family member, so we're actually looking into the genetics of all of that. If you have any family member who has gone blind before, grandmother and uncle and auntie, you should also have your eye examined. Yeah.
Now, quickly, some of us sit behind our computers for hours throughout the day. You understand me? Get those in the banks, those in corporate offices. You know, they've been, even the children, you mentioned earlier, that behind tablets and stuff and phones and stuff. How, you know, how do we keep that pressure? You know, that excessive light from the screens and stuff. Like, how do we take care of that? How do we keep going?
So, you can have your anti-reflective glasses. Anti-reflective glasses. Yeah. So you may not really have a refractive error, or you may not really be somebody who needs glasses, but you just worry it's because of your screen. Okay. So if you are somebody who has a lot of screen time, you can get that. It will reduce the amount of rays that is entering the eye, and that is also protective. Okay. Now, if you have, and then our sunshades out in the now that there's a lot of global warming, the sun rays and all that, you can have your shades that it also reflects the sunlight off your eyes. Yeah, and that is also quite a healthy practice. And then learn to rest the eye a bit. You know, just look out or something for some time, like the 2020 rule I spoke about. For
20 minutes, 20 seconds screen.
20 minutes screen.
20 minutes screen, 20 seconds.
20 feet away.
Okay, sure. 20 minutes screen time, 20 seconds, 20 feet away. That's what we do to give us better eye health. I know some kids are happy because she said outdoor play. They're pretty excited about that. But this has been a very educated conversation.
Thank you.
And one of my fears was the fact that cataract was a hereditary situation. But I'm grateful that you came through with this and we had this conversation. And I've been speaking with Dr. Daisy Asiama Asari, yes, and she's an ophthalmologist with the University of Ghana Medical Center and also with JH Medical Connect, Health Connect, I beg your pardon. Yes, I want to say a big thank you to Kinda Bubbly International School. They are so great supporting us on the Prime Morning. And don't forget that in the month of September, yes, Joy FM, Hits FM, Joy Prime online will be celebrating the Maestro. When we say the Maestro, you know we're talking about congenital, right? Yes. 4th September, that Friday is going to be all about congenital. Call in on the shows, go online and enjoy, share memories, request his songs, and have a fantastic time. Joy Prime is celebrating our own, celebrating music, and we're celebrating the Maestro. We'll take a quick break. When I come back, there's so much more on Prime Morning. My name is Najeli Doku.